mother and baby. Point 4. Support and guidance. Host. Having a strong support system and access to guidance is crucial during childbirth. Let us explore the pros and cons related to support and guidance during normal delivery. Pro. Emotional support. Many women find comfort and reassurance in having their loved ones present during labor. The support of a partner, family members, or a doula can help alleviate anxiety and provide encouragement. Con. Limited control. While having a support system is beneficial, the process of normal delivery can sometimes be unpredictable. This lack of control can be challenging for some women, leading to increased stress and anxiety. Conclusion. Host. In conclusion, the decision to opt for a normal delivery or any other birthing method is a personal one that should be made after careful consideration. Let us summarize the pros and cons we've discussed. Normal delivery is a natural process that promotes the release of beneficial hormones and strengthens the mother-child bond. Faster recovery and shorter hospital stay are advantages of normal delivery, but physical trauma such as perineal tears may occur. Emotional support during labor can be comforting, but the lack of control in the process can cause stress and anxiety. Remember, every pregnancy is unique, and it's essential to consult with healthcare professionals to make an informed decision. We hope this video has provided you with valuable insights to help you make the best choice for yourself and your baby. Don't forget to like and subscribe.
Menopause and Hormonal Changes Guide Tips Intro. Hey there, wonderful people. Welcome back to Health Lover. Today we're diving deep into incredible women out there. Menopause and hormonal changes. Yes, we're unraveling the mysteries behind those 15 crucial points. So, grab a cup of tea, get cozy, and let's get started. Point number one, understanding the basics. Menopause is a biological process that every woman goes through. Changes. Point 4, the infamous hot flashes. The notorious hot flashes. We've all heard about them, but what causes these sudden bursts of heat? Stay tuned as we explore this in point number 4. Point 5, sleep disturbances. Menopause often brings along sleep challenges. From insomnia to night sweats, getting a good night's sleep can become quite the struggle. But fear not, we'll discuss strategies to help you catch those Z's. Point 6, weight gain and metabolism. Hormonal changes can affect metabolism, making it easier to gain weight, especially around the abdominal area. But fret not, we've got tips during this phase. Point 7, bone health. Estrogen plays a crucial role in maintaining bone density. With its decline during menopause, the risk of osteoporosis increases. Let's delve into how to support your bones through nutrition and lifestyle choices. Point 8, memory and cognitive changes. Some women experience changes in memory and cognitive function during menopause. We'll explore these changes and share strategies to keep your mind sharp. Point 9, skin and hair transformations. Hormonal changes can impact the skin's elasticity and lead to hair thinning. But worry not, we've got beauty tips to help you embrace and enhance your natural radiance. Point 10, sexual health during menopause. Let's address the elephant in the room. Changes in hormones can affect libido and vaginal health. We'll discuss open communication with your partner and ways to maintain intimacy. Point 11, managing stress. Menopause can be a stressful time, but stress exacerbates symptoms. Learn effective stress management techniques to navigate this phase with grace. Point 12, hormone replacement therapy, HRT. For some women, HRT can be a game changer in managing menopausal symptoms. We'll explore the pros and cons to help you make an informed decision. Point 13, nutrition and supplements. A balanced diet and specific supplements can alleviate menopausal symptoms. Let's explore the foods and nutrients that can make a positive impact on your well-being. Point 14, exercise and its role. Regular physical activity can make a significant difference in how you experience menopause. Discover the types of exercises that can boost your mood and overall health. Point 15, embracing the journey. Menopause is a transformative period, and embracing the changes is key. We'll leave you with empowering tips to celebrate this new chapter of life. Outro. And there you have it, folks. 15 points to demystify menopause and hormonal changes. If you found this video helpful, don't forget to give it a thumbs up, subscribe to Healthcare Lover for more insightful content, and hit that notification bell so you
Sure, let us break down the key points for each trimester. First trimester, weeks 1-12, early signs and development overview of conception and early fetal development. Common symptoms like morning sickness, fatigue, and hormonal changes. Importance of prenatal vitamins and a healthy diet. Weeks 5-8, organ formation of vital organs and major body systems. Discuss potential early ultrasound and first heartbeat. Weeks 9-12, transition to second trimester, gradual reduction of some early symptoms. Introduction of prenatal screenings and tests. Second trimester, weeks 13-16, visible changes, baby's growth spurt and noticeable changes in the mother's body. Announcement of pregnancy to friends and family, weeks 17-20, gender reveal, discussion on when and how gender can be determined. Introduction of anatomy scan and potential genetic testing. Weeks 21-24, viability and quickening, fetal viability milestone. First experiences of fetal movements quickening. Third trimester, weeks 25-28, final trimester begins, overview of the home stretch. Importance of monitoring baby's movements. Weeks 29-32, preparing for labor, discussion on birthing classes and birth plans. Baby shower preparations and nesting instincts. Weeks 33-40, final preparations, physical and emotional changes in the mother. Signs of labor and when to contact healthcare provider. Packing hospital bag and finalizing birth plan. Postpartum, labor and delivery overview of labor stages and delivery options. Postpartum recovery and care for both mom and baby. Newborn care, basics of newborn care, feeding, and sleep. Emotional adjustments and potential postpartum support. Remember, this is just an outline. Feel free to expand on each point based on your audience and the depth you want to cover.
Pregnancy, childbirth, and all the associated experiences are, in my personal opinion, the most extraordinary processes in human biology. However, it's essential to recognize that it's not all sunshine and rainbows. Despite the beauty of children, the journey of bringing them into the world can entail some uncomfortable consequences. In today's video, we'll delve into the changes that occur in a mother's body during pregnancy, exploring phenomena such as morning sickness, fatigue, changes in taste, and the impacts on internal organs as the uterus expands to accommodate the growing fetus. Let's dive into this fascinating topic. Intro. While I may not have experienced pregnancy firsthand, I've had the privilege of witnessing this incredible process twice in my life. The sheer marvel of it is beyond words. My aim with this video is not to dwell on the negatives, but to shed light on some commonly experienced symptoms of pregnancy. In future videos, we'll explore the many beautiful aspects of pregnancy. First on the list is morning sickness. Contrary to its name, it can occur at any time of day and isn't obliged to vanish post-lunge. Although the precise cause remains elusive, the hormone HCG likely plays a significant role. HCG, or human chorionic gonadotropin, doubles every 48 to 72 hours during the first 12 weeks of pregnancy, peaking and then declining. Higher levels may indicate multiple pregnancies or issues like Down syndrome. While most experience relief by weeks 12 to 16, some endure severe morning sickness throughout, known as hyperemesis gravidarum, which poses serious challenges. Moving on to fatigue, progesterone, and its metabolite, allopregnanolone, are key players. Progesterone levels rise steadily throughout pregnancy, contributing to drowsiness due to enhanced responsiveness to the neurotransmitter GABA. Fatigue tends to ebb in the second trimester before resurfacing in the third, influenced by various hormonal changes and the physical and emotional toll of pregnancy. Another common phenomenon is changes in taste, often characterized by a metallic or bitter flavor. While the mechanism isn't fully understood, estrogen likely plays a significant role. Pregnant individuals, particularly females with elevated estradiol levels, report alterations in taste perception, affecting food preferences and aversions. Lastly, the third trimester brings physical discomfort as the expanding uterus displaces surrounding organs. The greater omentum, intestines, stomach, liver, gallbladder, and even the heart and lungs undergo significant shifts to accommodate the growing fetus. While these changes are awe-inspiring, they undoubtedly contribute to discomfort. There are numerous other transformations in a mother's body during pregnancy, including alterations in liver metabolism, kidney function, and digestive system, peristalsis. Feel free to suggest topics for future videos in the comments below. Thanks for tuning in, and I'll catch you in the next video. Ten Best Foods for Boosting Fertility in Women. Introduction. Greet your audience and introduce the topic. Mention the importance of nutrition in fertility. Point 1. Fruits and vegetables. Highlight the benefits of vitamins, minerals, and antioxidants. Provide examples of fertility-friendly fruits and vegetables. Point 2. Leafy greens. Emphasize the role of folate in reproductive health. Recommend specific leafy greens like spinach and kale. Point 3. Whole grains. Discuss the benefits of complex carbohydrates and essential nutrients. Suggest whole grains such as quinoa, brown rice, and oats. Point 4. Lean proteins. Explain the importance of protein without excess saturated fats. Recommend sources like poultry, fish, and plant-based proteins. Point 5. Nuts and seeds. Highlight the nutritional value of healthy fats, protein, and minerals. Name specific nuts and seeds beneficial for fertility. Point 6. Fatty fish. Discuss the role of omega-3 fatty acids in promoting fertility. Recommend fish options like salmon, mackerel, or sardines. Point 7. Dairy or alternatives. Stress the significance of calcium and vitamin D for reproductive health. Suggest dairy products or alternatives like fortified plant-based milk. Point 8. Avocado. Talk about the benefits of monounsaturated fats and folate in avocados. Provide creative ways to incorporate avocados into the diet. Point 9. Berries. Discuss the antioxidant-rich nature of berries. Name specific berries like blueberries and strawberries. Point 10. Water. Explain the importance of staying hydrated for overall health and fertility. Encourage viewers to prioritize water intake. Conclusion. Summarize key points. Invite viewers to share their thoughts or ask questions in the comments. Remember to engage your audience, maintain a conversational tone, and include any additional information or personal anecdotes that can enhance the video.
Introduction. Emphasize the transformative journey of pregnancy. Discuss the emotional and physical changes women experience. Calculating weeks. Clarify that the LMP method is a standard for tracking pregnancy. Note that not all months have the same number of days, so weeks may not align perfectly. Month-to-week conversion. Break down weeks further, explaining the significance of each week. Highlight milestones like the baby's heartbeat starting around week 6. Trimesters. Detail major developments in each trimester, such as organ formation and fetal movement. Discuss common symptoms and changes experienced by the mother. Due date calculation. Explain the Naegele's rule for estimating the due date. Stress the importance of ultrasounds for accurate dating and monitoring fetal growth. Common pregnancy terms. Elaborate on terms like term, preterm, and postterm. Discuss the potential challenges and care associated with preterm births. Tips for tracking. Recommend apps that provide daily insights and tips. Suggest creating a pregnancy journal to document experiences and questions for healthcare providers. Closing. Reinforce the uniqueness of each pregnancy journey. Express support for viewers going through this experience. Disclaimer. Emphasize that the provided information is general and may not cover specific cases. Encourage seeking professional advice for personalized guidance. Call to action. Ask viewers to share their pregnancy stories or questions. Remind them to consult healthcare providers for accurate and personalized information.
Hello everyone, and welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. At this stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional support and counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider for advice and guidance. So that's it for this week's video on pregnancy symptoms and baby development at 27 weeks. Thanks for tuning in, and we'll see you in next video. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's talk about some common symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Heartburn and indigestion are also common during the third trimester as your growing uterus puts pressure on your stomach, leading to acid reflux. Eating small, frequent meals and avoiding spicy or acidic foods can help alleviate these symptoms. Now let's talk about your baby's development at 28 weeks. At this stage, your baby weighs around 2.5 pounds and is approximately 15 inches long. Their brain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs expand and contract. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, and they can now hear your voice and your heartbeat. You may notice that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the 3rd trimester, they will be able to hiccup. So, what can you expect during the rest of the 3rd trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. You may also notice an increase in vaginal discharge, which is normal but should not have a strong odor or be accompanied by itching or burning. It is also important to start preparing for labor and delivery. Talk with your healthcare provider about your birth plan and attend childbirth education classes to learn about the different stages of labor and coping techniques for pain. In summary, at 28 weeks pregnant, you may experience symptoms such as fatigue, shortness of breath, and swelling. Your baby is rapidly growing and developing, and they can now hear your voice and blink their eyes. As you move into the 3rd trimester, be sure to continue monitoring your symptoms and preparing for labor and delivery. That's all for today's video. Thank you for watching, and be sure to subscribe to our channel for more pregnancy updates.
Hello, and welcome back to our pregnancy journey. Today we're going to talk about the 29th week of pregnancy and what you can expect for both your baby's development and your own body changes. Let's start with your baby. At this point, your little one is roughly the size of a butternut squash, weighing in at around 2.5 pounds and measuring about 15 inches long from head to toe. Your baby's brain is continuing to develop rapidly, and their lungs are starting to produce surfactant, a substance that helps them breathe on their own outside of the womb. Your baby's movements are becoming more pronounced, and you may start to notice a pattern of when they are most active. They are also starting to develop their sense of taste and can taste the amniotic fluid they swallow. Now, let's talk about your body changes. At 29 weeks pregnant, you may notice that your belly is getting bigger, and you're feeling more and more pregnant every day. As your uterus continues to expand, you may experience some discomfort or even pain in your lower back, hips, or pelvis. This is normal, but if you're concerned, talk to your healthcare provider. You may also notice some new symptoms, such as Braxton Hicks contractions. These are practice contractions that feel like your uterus is tightening and releasing. They're usually painless and irregular, but if you're experiencing them frequently or with any pain or discomfort, it's important to let your healthcare provider know. Other common symptoms at this stage of pregnancy include shortness of breath, heartburn, and difficulty sleeping. If you're having trouble sleeping, try sleeping on your left side with a pillow between your knees to support your lower back and hips. It's also important to keep up with your prenatal appointments and any recommended tests or screenings. At your 29-week appointment, your healthcare provider may check your blood pressure, measure your belly, and listen to your baby's heartbeat. As you enter the 3rd trimester of pregnancy, it's important to continue taking care of yourself and your growing baby. This means eating a healthy, balanced diet, staying hydrated, and getting regular exercise. Walking, swimming, and prenatal yoga are great options for staying active during pregnancy. It's also important to prepare for your baby's arrival. Start thinking about your birth plan and what kind of experience you want. Consider taking a childbirth education class, which can help you feel more prepared and confident about labor and delivery. In addition to preparing for the birth, you'll want to start thinking about what you'll need for your baby's arrival. This includes things like a car seat, crib, diapers, and clothing. Overall, the 29th week of pregnancy is an exciting time as your baby continues to grow and develop. As always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for tuning in, and we'll see you next time for another update on your pregnancy journey. Hello and welcome to this video about 30 weeks of pregnancy and baby development. This is an exciting time for both the mother and baby as there are many changes happening. In this video, we will discuss the baby's development, the mother's physical changes, and how to take care of yourself during this period. Baby development. At 30 weeks of pregnancy, the baby is about the size of a cucumber and weighs around 3 pounds. Here are some key developments happening at this stage. Brain development. The baby's brain is growing rapidly, and the cerebral cortex is developing, which is responsible for controlling movement, sensation, and perception. Lung development. The lungs are almost fully developed, and the baby is practicing breathing movements, which will help them breathe on their own after birth. Fat deposits. The baby is accumulating fat deposits under the skin, which will help regulate their body temperature and provide energy after birth. Sensory development. The baby's senses are becoming more refined, and they can recognize sounds, light, and even taste. Movement. The baby is quite active and can move around, kick, and even hiccup. You may feel their movements quite strongly at this stage. Mother's physical changes. As the baby grows, the mother's body will also go through many changes. Here are some of the most common physical changes at 30 weeks. Weight gain. Most women will have gained around 20 to 25 pounds by this stage of pregnancy. The weight gain is essential for the baby's growth and development. Braxton Hicks contractions. These are mild contractions that may be felt in the uterus. They are not usually painful and are a sign that the uterus is preparing for labor. Stretch marks. The skin around the abdomen may begin to stretch, causing stretch marks. These usually fade after pregnancy. Fatigue. As the baby grows, the mother may feel more tired and require more rest. Shortness of breath. The growing baby can put pressure on the diaphragm, making it harder to breathe deeply. Taking care of yourself. It's essential to take care of yourself during pregnancy to ensure both you and your baby stay healthy. Here are some tips for staying healthy during the 30th week of pregnancy. Eat a healthy diet. Make sure you are eating a balanced diet that includes plenty of fruits, vegetables, and lean protein. Avoid foods that are high in sugar or fat. Stay active. Regular exercise can help you feel better and reduce stress. Walking, swimming, and prenatal yoga are all good options. Conclusion. At 30 weeks of pregnancy, the baby is growing rapidly, and the mother's body is going through many changes. It's essential to take care of yourself and attend regular prenatal checkups to ensure both you and your baby stay healthy. Remember to eat a healthy diet, stay active, get plenty of rest, and drink plenty of water. Thank you for watching, and we wish you a healthy and happy pregnancy. Hello and welcome back to our series on pregnancy. Today, we will be discussing week 31 of pregnancy and everything you need to know about your baby's development and your symptoms. So, let's get started. Baby development. At week 31, your baby is approximately 16 inches long and weighs around 3.5 pounds. Here are some of the key developments happening to your baby during this time. Rapid brain growth. Your baby's brain is growing rapidly during this time, which means that they will be able to process information more efficiently. Lung development. Your baby's lungs are almost fully developed at this point, and they are practicing their breathing movements. Sleep cycles. Your baby is now starting to have regular sleep and wake cycles. Baby fat. Your baby is putting on more baby fat, which helps regulate their body temperature after birth. Symptoms. As you enter the final trimester of your pregnancy, you may experience some new symptoms or the worsening of old ones. Here are some of the common symptoms that you may experience at week 31. Braxton Hicks contractions. You may start to experience Braxton Hicks contractions, which are mild contractions that help prepare your body for labor. Shortness of breath. As your uterus grows and pushes against your diaphragm, you may experience shortness of breath. Back pain. As your baby grows, the weight can put pressure on your back, causing discomfort. Swelling. You may experience swelling in your feet, ankles, and hands due to the increased fluid in your body. Heartburn. As your uterus grows, it can put pressure on your stomach, causing acid reflux and heartburn. Fatigue. As your body works hard to support your growing baby, you may feel more tired than usual. Frequent urination. Your baby's position may put pressure on your bladder, causing you to urinate more frequently. Tips for a healthy pregnancy. Eat a healthy diet. Make sure to eat a well-balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins. Stay hydrated. Drink plenty of water and other fluids throughout the day to stay hydrated. Exercise. Gentle exercise, such as walking or swimming, can help relieve some of your pregnancy symptoms and prepare your body for labor. Attend prenatal appointments. Regular prenatal appointments with your healthcare provider are essential to monitor your baby's growth and ensure a healthy pregnancy. Take childbirth classes. Childbirth classes can help prepare you and your partner for labor and delivery. Conclusion. At week 31 of pregnancy, your baby is continuing to grow and develop rapidly. You may experience some new symptoms or the worsening of old ones, but there are steps you can take to stay healthy and comfortable during this time. Remember to eat a healthy diet, stay hydrated, exercise, get plenty of rest, attend prenatal appointments, take childbirth classes, and practice relaxation techniques. With these tips, you can have a healthy and happy pregnancy. Thanks for tuning in, and we'll see you next time. Hello everyone, welcome to my YouTube channel. Today we will be discussing 32 weeks pregnancy and baby development, symptoms, tips, and healthcare. As a senior gynecologist, I have had years of experience helping women through their pregnancy journey. So, without further ado, let's get started. Baby development. At 32 weeks, your baby is about the size of a large jicama, measuring around 16.7 inches long and weighing about 4 pounds. Your baby's eyes are now fully formed and can open and close them. The bones in your baby's skull are not yet fused, which allows for easier passage through the birth canal during delivery. Your baby's immune system is starting to develop, and they are producing white blood cells to help fight off infections. Your baby's lungs are also continuing to develop and produce surfactant, a substance that helps keep the air sacs in the lungs from sticking together. Symptoms. At 32 weeks, you may experience increased back pain and discomfort as your baby continues to grow and put pressure on your back and pelvis. You may also experience increased fatigue and difficulty sleeping due to the physical strain of pregnancy. Braxton Hicks contractions, or practice contractions, may become more frequent as your body prepares for labor. Heartburn and indigestion may also become more common as your baby continues to push up on your stomach. Swelling in your feet and ankles may become more pronounced as your body retains more fluids. Tips. To help alleviate back pain, try using a pregnancy pillow to support your belly and lower back while sleeping. Practice good posture and avoid standing or sitting in the same position for too long to help prevent back pain and swelling. Stay hydrated and try to keep your feet elevated as much as possible to reduce swelling. To help manage heartburn and indigestion, try eating smaller, more frequent meals and avoid foods that trigger symptoms. Make sure to stay active and get regular exercise, such as walking or prenatal yoga, to help maintain your overall health and prepare your body for labor. Healthcare. At 32 weeks, you will typically have a prenatal visit with your healthcare provider to check on your baby's growth and development. Your healthcare provider may also perform a Group B Streptococcus (GBS) test to check for the presence of bacteria that can be harmful to your baby during delivery. It is important to continue taking any prescribed prenatal vitamins and medications as directed by your healthcare provider. In conclusion, 32 weeks is an important milestone in your pregnancy journey. Your baby is continuing to develop and grow, and you may experience new symptoms and challenges. Remember to practice good self-care, stay active, and attend all scheduled prenatal appointments to ensure a healthy pregnancy and delivery. Thank you for watching, and I'll see you in the next video. Hello everyone. Today, we will talk about the 33 week of pregnancy and the development of the baby at this stage. We will also discuss some common symptoms that mothers experience during this period and tips for taking care of their health. Baby development. At 33 weeks, the baby is about 17 inches long and weighs around 4 pounds. The baby's lungs are still developing and producing surfactant, a substance that helps the lungs expand and contract properly after birth. The baby's brain is rapidly developing, and they can now sense light and dark. The baby's bones are hardening, and they are gaining more fat under their skin, which will help regulate their body temperature after birth. The baby's movements are becoming more coordinated, and they can respond to sound. Symptoms. Braxton Hicks contractions. These are practice contractions that help prepare the uterus for labor. They can be uncomfortable but are usually not painful. Backaches. As the uterus expands, it puts pressure on the lower back, causing discomfort. Shortness of breath. The growing uterus can also put pressure on the diaphragm, making it harder to breathe. Fatigue. As the body works harder to support the growing baby, mothers may feel more tired than usual. Swelling. The body retains more water during pregnancy, causing swelling in the feet, ankles, and hands. Tips for health care. Continue to eat a healthy and balanced diet, including plenty of fruits, vegetables, and protein. Stay hydrated by drinking plenty of water and avoiding sugary or caffeinated beverages. Exercise regularly, but avoid strenuous activities that could put too much strain on the body. Sleep on your side, preferably the left side, to improve blood flow to the baby and reduce the risk of stillbirth. Attend all prenatal appointments and communicate any concerns with your healthcare provider. Preparing for birth. Start thinking about a birth plan, including preferences for pain management and delivery options. Consider taking childbirth classes to learn about the labor process and techniques for coping with pain. Pack a hospital bag with essentials for both mother and baby, including clothing, toiletries, and a car seat. Talk to your healthcare provider about the signs of labor and when to call or go to the hospital. Conclusion. As you approach the end of your pregnancy journey, it is important to take care of yourself and your growing baby. Remember to listen to your body, attend all prenatal appointments, and communicate any concerns with your healthcare provider. By taking these steps, you can help ensure a healthy and safe delivery for both you and your baby. Thank you for watching, and I wish you all the best in your pregnancy journey. Hello everyone, we are going to discuss pregnancy at 34 weeks. At this stage, your baby is approximately 18 inches long and weighs around 4.5 pounds. Your baby's organs are fully gain weight and grow. Braxton Hicks contractions. These are practice contractions that your body goes through as it prepares for labor. They can be uncomfortable but are usually not painful. Shortness of breath. As your baby continues to grow, it can push against your diaphragm and make it harder to breathe. You may notice that you need to take more frequent breaks or rest periods. Pelvic pain. As your baby moves into the birth canal, you may experience discomfort or pain in your pelvic area. Swelling. Many women experience swelling in their feet and ankles during pregnancy. Make sure to elevate your feet when possible and stay hydrated. Gestational diabetes. This is a type of diabetes that develops during pregnancy. If you are diagnosed with gestational diabetes, your doctor may recommend a special diet and monitoring your blood sugar levels. Preeclampsia. This is a potentially serious condition that can develop during pregnancy, characterized by high blood pressure and protein in the urine. If you experience symptoms like severe headaches, vision changes, or abdominal pain, contact your doctor immediately. Fetal movement. You should continue to monitor your baby's movements and contact your doctor if you notice any significant changes. Now, let's talk about some tips for taking care of yourself during this stage of pregnancy. Rest. As your due date approaches, make sure to get plenty of rest and sleep. This will help you conserve your energy for labor and delivery. Stay hydrated. Drink plenty of water and avoid sugary or caffeinated drinks. Exercise. Gentle exercise like walking or prenatal yoga can help you stay healthy and prepare your body for labor. Kegel exercises. These exercises can help strengthen your pelvic floor muscles and prepare your body for childbirth. Prenatal classes. Consider taking a prenatal class to learn more about childbirth, breastfeeding, and newborn care. Pack your hospital bag. Start packing your hospital bag with essentials like clothes for you and your baby, toiletries, and important documents. Talk to your doctor. Make sure to keep your doctor updated on any symptoms or concerns you may have. Finally, let's talk about your baby's development at 34 weeks. Baby's lungs. Your baby's lungs are almost fully developed, and they are practicing breathing movements in preparation for birth. Body fat. Your baby is continuing to gain weight and develop body fat, which will help regulate their body temperature after birth. Sleep and wake cycles. Your baby may start to have regular sleep and wake cycles, which can help prepare them for life outside the womb. Head down position. Most babies will move into the head down position in preparation for delivery. Overall, pregnancy at 34 weeks is an exciting and important time as you prepare for the birth of your baby. Remember to take care of yourself and stay in touch with your doctor as you get closer to your due date. Thanks for watching, and I'll see you in the next video. "35 weeks pregnancy. Baby development and symptoms." Welcome back to our channel, where we explore the incredible journey of pregnancy. Today, we're going to dive into the exciting world of 35 weeks of pregnancy. At this stage, your baby is rapidly developing, and you may be experiencing various symptoms. So let's get started. Baby's development. Your baby now weighs around 5.5 to 6 pounds and measures about 18 inches from head to toe. The baby's organs and systems are nearly fully developed, and the lungs continue to mature. The skin is becoming smoother as the fat layers continue to fill out. Your baby's brain is rapidly growing, and the nervous system is maturing. The baby's bones are fully formed but are still flexible to ease the birthing process. Symptoms you may experience. Braxton Hicks contractions. You may experience more frequent and intense practice contractions, which can help prepare your body for labor. Shortness of breath. As your uterus expands, it pushes against your diaphragm, making it harder to take deep breaths. Increased vaginal discharge. It's common to have a thicker and heavier discharge at this stage, but consult your doctor if it's accompanied by itching, burning, or a foul odor. Pelvic discomfort. The growing baby puts pressure on your pelvis, leading to pelvic pain or discomfort. Frequent urination. The baby's position and size may put pressure on your bladder, causing the need to urinate more often. Trouble sleeping. Finding a comfortable position becomes more challenging, and you may experience pregnancy-induced insomnia. Heartburn and indigestion. Hormonal changes and the baby's position can lead to increased acidity and digestive issues. Self-care tips for this stage. Rest and sleep. Listen to your body and prioritize getting enough rest and sleep. Exercise. Engage in gentle exercises like walking or prenatal yoga to stay active and relieve discomfort. Pelvic floor exercises. Strengthen your pelvic floor muscles by practicing Kegel exercises. Maintain a healthy diet. Focus on well-balanced meals that include fruits, vegetables, lean proteins, and whole grains. Stay hydrated. Drink plenty of water throughout the day to prevent dehydration and assist with digestion. Use proper body support. Invest in a maternity support belt or pillow to help alleviate back and pelvic pain. Practice relaxation techniques. Deep breathing exercises, meditation, or prenatal massages can help reduce stress and promote relaxation. Prepare for breastfeeding. Attend breastfeeding classes, educate yourself about proper latch techniques, and gather essential supplies. And that wraps up our exploration of 35 weeks of pregnancy. Remember, every pregnancy is unique, and if you have any concerns or questions, consult your healthcare provider. Stay tuned for more exciting updates on the journey of pregnancy. Don't forget to like, subscribe, and hit that notification bell to never miss an episode. Take care, and we'll see you next time. Greetings and welcome back to our Pregnancy Journey series. Today, we're diving into the incredible journey of the 36th week of pregnancy. As your due date gets closer, both you and your baby are experiencing some remarkable changes. Let's explore the symptoms you may encounter and the exciting developments happening to your little one. Maternal symptoms at 36 weeks. Increased discomfort. Your baby's growth puts additional pressure on your abdomen, causing discomfort and backaches. Frequent urination may persist as your baby continues to press on your bladder. Shortness of breath can occur due to limited space for your lungs. Braxton Hicks contractions. These contractions, also known as practice contractions, become more noticeable and frequent. They help prepare your body for labor, but they are usually irregular and mild. Swollen feet and ankles. Fluid retention can cause swelling in your feet and ankles. Elevating your legs and wearing comfortable shoes can help alleviate this symptom. Nesting instinct. Many women experience a strong urge to prepare their homes for the baby's arrival. This may involve cleaning, organizing, and setting up the nursery. Insomnia and fatigue. Discomfort, frequent bathroom trips, and hormonal changes can disrupt your sleep. Take short naps, practice relaxation techniques, and maintain a consistent sleep routine. Baby development at 36 weeks. Size and weight. Your baby is approximately 18 inches long and weighs around 6 pounds. Although still growing, they are almost fully developed. Fetal position. Most babies settle into the head-down position, preparing for birth. The head engages into the pelvis, which is a sign that labor might be approaching. Lung development. By 36 weeks, your baby's lungs have matured significantly. They continue to produce surfactant, a substance that helps the lungs expand and function properly after birth. Immune system. Your baby's immune system strengthens as they receive antibodies from you through the placenta. This provides them with some protection against infections early in life. Brain and nervous system. The brain development is almost complete, with rapid growth in the cerebral cortex. Your baby's nervous system is fully functional, and they can process information and regulate body temperature. Baby's movement. Due to limited space, you may feel more rolling and stretching movements instead of kicks. Hiccups are common as your baby practices swallowing and inhaling amniotic fluid. Preparations for the upcoming weeks. Finalize birth plan. Discuss your birth preferences with your healthcare provider and ensure they are included in your birth plan. Pack your hospital bag. As your due date nears, have a bag ready with essentials for you and your baby. Include comfortable clothing, toiletries, nursing bras, baby clothes, diapers, and important documents. Attend childbirth classes. Join childbirth education classes to learn about labor, pain management, and relaxation techniques. Discuss breastfeeding. Talk to your healthcare provider or a lactation consultant about breastfeeding techniques and potential challenges. Hello and welcome back to our pregnancy journey. Today, we're diving into the incredible journey of week 37 of pregnancy. As we approach the final stretch, both you and your baby are going through significant changes. So, let us explore the symptoms and developments you can expect during this exciting time. But before we begin, don't forget to hit that subscribe button and ring the notification bell, so you don't miss any of our future videos. Week 37 marks the beginning of the 9th month of pregnancy, and your baby is almost ready to make their grand entrance into the world. Let us start by taking a look at the baby's development. At this stage, your baby weighs around 6.5 pounds, 2.9 kilograms and measures approximately 19 inches 48 centimeters long. They are fully developed and are fine-tuning their systems for life outside the womb. Their organs, including the lungs, digestive system, and immune system, are all working in unison, preparing for the transition. Now, let us discuss the symptoms and changes you may experience during week 37. Increased pressure and discomfort. Host, as your baby continues to grow, you may experience increased pressure and discomfort in your pelvic region. This happens as your baby's head descends into the pelvis, preparing for birth. This can lead to a frequent need to urinate, difficulty walking, and even back pain. Braxton Hicks contractions. Host, you may also notice an increase in Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. These contractions are usually irregular and less painful than true labor contractions. Remember to stay hydrated and practice relaxation techniques to ease any discomfort. Fatigue and difficulty sleeping. Host, fatigue and difficulty sleeping can become more prominent during week 37. Your growing belly, frequent bathroom trips, and discomfort can make it challenging to find a comfortable position. Try using pillows for support and establishing a relaxing bedtime routine to improve your sleep. Increased vaginal discharge. Host, during this stage, you might notice an increase in vaginal discharge. This discharge, known as leukorrhea, helps prevent infections. However, if you experience any changes in color, consistency, or a foul odor, it's essential to consult your healthcare provider. Swelling and varicose veins. Host, swelling, especially in the feet and ankles, can become more pronounced at this stage of pregnancy. Additionally, you might notice the appearance of varicose veins due to increased blood volume and pressure. Elevating your legs, wearing compression stockings, and taking regular walks can help alleviate these symptoms. Emotional changes. Host, lastly, as your due date approaches, you might experience a mix of emotions, including excitement, nervousness, and even anxiety. It's essential to surround yourself with a support system and communicate your feelings with your loved ones. And that wraps up our journey through week 37 of pregnancy. It's amazing to see how far both you and your baby have come. Remember, each pregnancy is unique, so if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Stay tuned for our next video, where we'll discuss the final stages of pregnancy and the upcoming labor and delivery. Don't forget to like this video and leave a comment below if you found this information helpful. Until next time, take care and enjoy the remaining weeks of your pregnancy journey. Thank you for watching, and we'll see you soon. Hello, and welcome back to our YouTube channel, where we discuss all things pregnancy and baby related. Today, we're diving into the fascinating world of 38 weeks of pregnancy. So, let us get started. Baby's size and weight. At 38 weeks, your baby is approximately the size of a pumpkin, measuring around 19 to 21 inches 48 to 53 centimeters and weighing about 6 to 7 pounds 2.7 to 3.2 kilograms. Your little one has been growing and developing rapidly throughout the pregnancy journey. Organ development. By this stage, your baby's organs, including the lungs, digestive system, and immune system, are almost fully developed. These organs have been maturing over the past several weeks, preparing your baby for life outside the womb. Baby's position. Most babies settle into a head-down position in the uterus by 38 weeks. This is known as the vertex or cephalic presentation, which is the ideal position for a vaginal delivery. However, if your baby is not in the head-down position, your healthcare provider may discuss options for encouraging the baby to turn. Braxton Hicks contractions. You may be experiencing Braxton Hicks contractions more frequently now. These practice contractions feel like a tightening of the abdomen and are a way for your body to prepare for labor. If the contractions become regular, intense, or are accompanied by other signs of labor, it's important to contact your healthcare provider. Pelvic discomfort. At this stage, you may experience increased pelvic pressure and discomfort. Your baby's fatigue and difficulty sleeping. As your belly grows bigger, it can become challenging to find a comfortable sleeping position. You may also experience frequent bathroom trips during the night. Combined with anticipation and hormonal changes, this can lead to fatigue. It's important to rest as much as possible and practice relaxation techniques. Nesting instinct. Many expectant mothers experience a surge in energy and the desire to prepare their home for the baby during the final weeks of pregnancy. This is often referred to as the nesting instinct. It's a natural urge to clean, organize, and make sure everything is ready for the arrival of your little one. Emotional changes. With the due date approaching, it's common to feel a mix of excitement, anxiety, and a range of other emotions. The hormonal fluctuations can contribute to mood swings as well. Remember to communicate with your partner and support system, and don't hesitate to seek professional help if you're feeling overwhelmed. Hospital bag and birth plan. Now is the time to make sure your hospital bag is packed and ready to go. Include essentials like comfortable clothes, toiletries, and items for the baby. It's also a good idea to have your birth plan written out and discuss it with your healthcare provider. However, keep in mind that labor and delivery can be unpredictable, so be flexible with your expectations. That wraps up our discussion on the development and symptoms during 38 weeks of pregnancy. We hope you found this information helpful and informative. Don't forget to subscribe to our channel for more pregnancy and baby-related content. As always, take care of yourself and your little one. See you next time. Welcome to our YouTube channel, where today, we'll take you on a fascinating journey through the 39 weeks of pregnancy and baby development. From the magical moment of conception to the incredible birth of a new life, we'll explore the various stages, milestones, and changes that occur during this remarkable process. So, let us dive right in. Week 1 Conception. Host. In Week 1, conception occurs when a sperm fertilizes an egg, forming a zygote. This tiny cluster of cells begins its journey towards the uterus. Week 2 Implantation. Host. By Week 2, the zygote implants itself into the uterine lining, where it will receive nourishment and continue its rapid division and growth. Week 3 Embryonic Development. Host. During Week 3, the zygote becomes an embryo, and its cells start differentiating into the brain, spinal cord, and other essential structures. Week 4 Heartbeat. Host. In the 4th week, the heart starts to beat, and the embryo begins to take on a recognizable shape. It's about the size of a poppy seed at this stage. Week 5 Nervous System. Host. By Week 5, the nervous system starts developing, and limb buds appear, which will eventually grow into arms and legs. Week 6 Facial Features. Host. In Week 6, the embryo's facial features, such as eyes, ears, and a mouth, begin to form. Week 7 Organ Development. Host. Week 7 marks the beginning of organ development, with the brain, lungs, liver, and kidneys all starting to take shape. Week 8 Fetal Stage. Host. At Week 8, the embryo officially becomes a fetus. It's about the size of a raspberry and can start moving its limbs. Week 9-12 Rapid Growth. Host. During weeks 9 to 12, the fetus undergoes rapid growth. Its sex organs start to form, and it can make small movements, though the mother cannot feel them yet. Week 13 Trimester 1 ends. Host. At Week 13, the first trimester comes to an end. The fetus is now about the size of a lemon, and its tiny fingerprints are forming. Week 14-16 Developing Senses. Host. In weeks 14 to 16, the fetus's senses begin to develop. It can now hear sounds from the outside world and may even suck its thumb. Week 17-20 Movement Sensation. Host. During weeks 17 to 20, the mother starts to feel the baby's movements. The fetus's skin becomes covered with vernix, a protective waxy substance. Week 21-24 Viability. Host. At weeks 21 to 24, the fetus reaches the age of viability, where it has a chance of survival outside the womb with medical assistance. Week 25-28 Rapid Brain Development. Host. During weeks 25 to 28, the baby's brain undergoes significant development. The eyes open and close, and the fetus has distinct sleep-wake cycles. Week 29-32 Developing Immune System. Host. In weeks 29 to 32, the baby's immune system strengthens as it receives antibodies from the mother. Week 33-36 Lung Development. Host. At weeks 33 to 36, the baby's lungs mature, and it assumes a head-down position in preparation for birth. Week 37 full term, host, congratulations. At week 37, the baby is considered full term, and it's now ready to be born. Week 38-39 final weeks, host, in the final weeks, the baby drops lower into the pelvis, relieving pressure on the mother's diaphragm and making breathing easier. Birth, host, and now, after an incredible journey of 39 weeks, it's time for the most momentous event, the birth of the baby. It's a miraculous and emotional experience that marks the beginning of a new chapter in the lives of both the parents and the newborn. Conclusion, host, pregnancy and baby development encompass an awe-inspiring process that showcases the wonders of life. From a single cell to a fully formed human being, these 39 weeks are filled with incredible growth, milestones, and changes. We hope you enjoyed this journey with us today. Outro, host, if you found this video informative and fascinating, don't forget to like and share it with others who might be interested. Subscribe to our channel for more captivating content on parenting, health, and lifestyle. Thanks for watching, and we'll see you in the next video.
Title: 40 Weeks of Pregnancy, Symptoms, and Baby Development. Introduction: Welcome to our comprehensive guide on the incredible journey of pregnancy, spanning 40 weeks of symptoms and baby development. Weeks 1-4. Week 1, conception occurs, and the journey begins. Week 2, the fertilized egg travels down the fallopian tube. Week 3, implantation takes place, and the embryo starts to form. Week 4, the embryo develops the neural tube, which will become the brain and spinal cord. Weeks 5-8. Week 5, the heart begins to beat, and limb buds form. Week 6, facial features and the heart's chambers start to develop. Week 7, baby's arms and legs grow longer, and facial features become more defined. Week 8, the embryo is now called a fetus, and organs continue to form. Weeks 9-12. Week 9, fingers and toes start to develop, and the fetus can make spontaneous movements. Week 10, the baby's facial expressions begin, and the vital organs are functioning. Week 11, the fetus is about the size of a lime, and gender can be determined. Week 12, baby's reflexes develop, and the risk of miscarriage decreases significantly. Weeks 13-16. Week 13, baby's vocal cords begin to form, and the digestive system develops. Week 14, facial features become more distinct, and the baby can now squint and frown. Week 15, the baby starts producing urine and the skin becomes more transparent. Week 16, baby's movements become more coordinated and the bones harden. Week 17-20. Week 17, the fetus can hear external sounds and the umbilical cord thickens. Week 18, baby's taste buds form and the nervous system continues to mature. Week 19, vernix caseosa, a protective layer, covers the skin. Week 20, halfway there. The baby can suck its thumb, and the mother may feel the first movements. Weeks 21-24. Week 21, eyebrows and eyelashes develop, and the baby can taste the amniotic fluid. Week 22, the fetus is now responsive to light and dark. Week 23, rapid brain growth occurs, and lungs continue to develop. Week 24, the baby's viability outside the womb increases, though it's still premature. Weeks 25-28. Week 25. Baby's kicks become stronger, and lungs are maturing further. Week 26, eyes open, and the baby responds to external stimuli. Week 27, rapid weight gain begins, and the nervous system is fine-tuning. Week 28, the third trimester begins, and the baby's survival chances significantly improve. Weeks 29-32. Week 29, the baby's bones fully harden, and the kicks and movements may be visible. Week 30, lungs are almost fully developed, and the baby practices breathing. Week 31, the baby's immune system strengthens. Week 32, baby's toenails and fingernails grow, and the head settles into the pelvis. Weeks 33-36. Week 33, the baby's bones are fully formed, and the nervous system is maturing. Week 34, the baby practices blinking, and the amniotic fluid decreases as the baby grows. Week 35, the baby's liver and kidneys are fully functional. Week 36, The baby is gaining weight rapidly, preparing for birth. Weeks 37-40, week 37, full term. The baby's organs are ready for life outside the womb. Week 38, the baby's immune system gets a boost from the mother. Week 39-40, the baby may arrive any time now. The mother might experience signs of labor, and it's time to prepare for the exciting moment of birth. Conclusion. As the 40-week journey concludes, we celebrate the incredible process of pregnancy, from conception to the miraculous moment of welcoming a new life into the world. Stay tuned for more parenting tips and guidance on our channel. Conceiving with PCOS, 20 tips for a successful pregnancy journey. 1. Introduction. Welcome to our channel. Today, we're discussing a topic that many women with polycystic ovary syndrome, PCOS, face: how to increase the chances of getting pregnant despite PCOS. 2. Understand PCOS. Briefly explain what PCOS is and its impact on fertility. 3. Consult a specialist. Point out the importance of seeking advice from a fertility specialist or gynecologist. 4. Lifestyle changes. Discuss the significance of adopting a healthy lifestyle, including a balanced diet and regular exercise. 5. Maintain a healthy weight. Highlight the connection between weight management and PCOS-related fertility issues. 6. Monitor ovulation. Explain methods for tracking ovulation, such as using ovulation predictor kits. 7. Timing intercourse. Offer guidance on the optimal timing for intercourse during the menstrual cycle. 8. Fertility-friendly diet. Suggest foods that may positively impact fertility for women with PCOS. 9. Stay hydrated. Emphasize the importance of staying hydrated for overall reproductive health. 10. Reduce stress. Discuss stress management techniques as stress can impact fertility. 11. Supplements. Introduce supplements like folic acid and inositol that may support fertility. 12. Medications. Briefly mention medications that may be prescribed to regulate ovulation. 13. In vitro fertilization, IVF. Touch on the option of assisted reproductive technologies like IVF. 14. Acupuncture. Mention studies suggesting acupuncture may aid fertility in women with PCOS. 15. Regular checkups. Encourage regular checkups to monitor progress and adjust strategies if needed. 16. Partners' health. Remind that male fertility is crucial and partners should maintain their health. 17. Educate yourself. Encourage women with PCOS to educate themselves on their condition and fertility. 18. Community support. Recommend joining online communities or support groups for sharing experiences. 19. Patience and persistence. Emphasize that the journey might take time and persistence is key. 20. Closing. Conclude with a message of hope, reminding viewers that many women with PCOS
C-Section Recovery Guide, 20 Essential Tips for New Moms. 1. Introduction. Start by welcoming viewers and acknowledging the commonality of C-sections in childbirth. 2. Immediate post-op care. Discuss the importance of following medical advice for wound care and pain management. Highlight the significance of rest and limited physical activity in the initial days. 3. Incision care. Explain how to clean and care for the incision site. Stress the significance of keeping the incision dry and watching for signs of infection. 4. Pain management. Talk about prescribed pain medications and their proper usage. Suggest non-pharmacological methods like using a heating pad or practicing deep breathing exercises. 5. Activity guidelines. Emphasize the need for gradual reintroduction of daily activities. Recommend avoiding heavy lifting and strenuous exercise until approved by a healthcare professional. 6. Nutrition and hydration. Highlight the importance of maintaining a healthy diet for recovery. Encourage staying hydrated to aid in healing. 7. Monitoring postpartum bleeding. Discuss what is considered normal postpartum bleeding. Seek medical attention. 8. Emotional well-being. Address the emotional aspects of recovery and potential postpartum emotions. Encourage open communication with healthcare providers about mental health concerns. 9. Follow-up appointments. Stress the importance of attending postoperative checkups. Explain what to expect during these appointments and how healthcare providers monitor recovery. 10. Support system. Discuss the role of family and friends in providing support. Emphasize the importance of seeking help when needed. 11. Breastfeeding after C-section. Offer guidance on breastfeeding positions that are comfortable post-surgery. Highlight the benefits of breastfeeding for both the mother and baby. 12. Scar massage. Introduce scar massage as a technique to promote healing and reduce scar tissue. Demonstrate gentle massage techniques. 13. Resuming intimacy. Discuss the importance of waiting until physically and emotionally ready. Provide tips for comfortable intimacy post-C-section. 14. Postpartum exercise guidelines. Explain when it's safe to start postpartum exercises. Offer examples of gentle exercises to aid in recovery. 15. Birth control options. Discuss contraceptive options suitable for post-C-section recovery. Encourage discussions with healthcare providers about family planning. 16. Warning signs. Outline potential complications and the importance of recognizing warning signs. Stress the need to seek immediate medical attention for any concerning symptoms. 17. Scar appearance. Address common concerns about the appearance of the scar. Provide reassurance that scars tend to fade over time. 18. Returning to work. Discuss factors to consider when planning a return to work. Emphasize the importance of balancing work responsibilities with ongoing recovery needs. 19. Long-term care considerations. Mention the potential for future pregnancies and how that may impact the C-section scar. Discuss any long-term considerations or precautions advised by healthcare professionals. 20. Conclusion. Summarize key points. Encourage viewers to consult with their healthcare providers for personalized advice. Remember to tailor the script to your audience and provide a disclaimer to consult with healthcare professionals for personalized advice.
Title: Effective PCOS Treatment, 20 Key Steps to Manage Polycystic Ovary Syndrome. 1. Introduction. Greet your viewers and provide a brief overview of PCOS. Mention the importance of early diagnosis and management. 2. Understanding PCOS. Explain what PCOS is and its impact on women's health. Highlight common symptoms such as irregular periods, acne, and weight gain. 3. Seek professional help. Emphasize the importance of consulting a healthcare professional for a proper diagnosis. Encourage viewers to find a healthcare provider experienced in managing PCOS. 4. Lifestyle modifications. Discuss the role of diet and exercise in managing PCOS symptoms. Suggest a balanced diet with emphasis on whole foods and regular physical activity. 5. Weight management. Address the link between PCOS and weight gain. Provide tips on healthy weight loss strategies, if applicable. 6. Medication options. Briefly explain common medications prescribed for PCOS, such as birth control pills and anti-androgens. Highlight the importance of medication adherence. 7. Nutritional supplements. Discuss supplements like inositol and vitamin D that may benefit women with PCOS. Emphasize consulting a healthcare professional before starting any supplement regimen. 8. Fertility considerations. Touch on the challenges PCOS may pose to fertility. Mention fertility treatments and options for those planning to conceive. 9. Hormonal balance. Explain how hormonal imbalances play a role in PCOS. Discuss hormone therapy options prescribed by healthcare professionals. 10. Regular monitoring. Stress the need for regular checkups and monitoring of PCOS symptoms. Encourage open communication with healthcare providers. 11. Stress management. Discuss the impact of stress on PCOS symptoms. Suggest stress reduction techniques such as meditation and yoga. 12. Sleep hygiene. Highlight the importance of adequate sleep for overall health. Discuss the link between PCOS and sleep disturbances. 13. Skincare. Address skin-related concerns associated with PCOS. Provide skincare tips to manage acne and other skin issues. 14. Customized treatment plans. Acknowledge that PCOS treatment is not one size fits all. Encourage viewers to work with their healthcare providers to develop personalized plans. 15. Educational resources. Recommend reliable sources for further PCOS education. Mention reputable websites and support groups. 16. Community support. Emphasize the value of connecting with others who have PCOS. Mention online forums or local support groups. 17. Ongoing education. Encourage viewers to stay informed about new developments in PCOS research. Highlight the importance of staying proactive in managing one's health. 18. Mind-body connection. Discuss the impact of mental health on PCOS. Encourage practices that promote a healthy mind-body connection. 19. Long-term outlook. Discuss the long-term management of PCOS. Address the potential impact on overall health as women age. 20. Conclusion. Summarize key points. Encourage viewers to take a proactive approach to their PCOS management. Remember to tailor the script to your audience and provide accurate, up-to-date information.
10 healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes.
Introduction. Greet your viewers warmly. Briefly share your excitement about documenting your pregnancy journey. Week 4-6, Discovery. Discuss how you found out about the pregnancy. Share your initial thoughts and emotions. Week 7-10, First trimester symptoms. Detail common symptoms like morning sickness and fatigue. Offer tips on coping with these symptoms. Week 11-13, First ultrasound. Share your experience with the first ultrasound. Discuss any surprises or emotions during this appointment. Week 14-16, Gender reveal. If you've discovered the gender, reveal it to your audience. Share any creative or special gender reveal ideas you used. Week 17-20, Second trimester milestones. Discuss improvements in symptoms. Share any notable milestones, like feeling the first kicks. Week 21-24, Maternity fashion. Showcase your favorite maternity outfits. Offer tips for staying stylish and comfortable. Week 25-28, Baby shower preparation. Discuss planning and organizing your baby shower. Share any memorable moments from the celebration. Week 29-32, third trimester challenges address common challenges like back pain and sleep difficulties. Offer advice on staying comfortable during this stage. Week 33-36, nesting and preparing show your audience how you're preparing for the baby's arrival. Discuss any nesting instincts or rituals you've experienced. Week 37-40, final countdown, share your thoughts and emotions as you approach your due date. Discuss any last-minute preparations or anxieties. Labor and delivery, document your labor experience as much as you're comfortable. Share your feelings and reactions during the delivery. Welcome baby, postpartum, introduce your newborn to your audience. Discuss your postpartum experiences and emotions. Conclusion, express gratitude to your viewers for joining you on this journey. Share your plans for future videos or updates on your growing family. Six weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Mom's body at 6 weeks pregnant. This week, your breasts may feel tender or achy because of increased blood flow. This is a normal part of your body preparing for breastfeeding. Wearing a supportive bra can help with discomfort. You may also experience constipation because of an increase in progesterone, which slows down the digestive tract. To deal with this, exercise regularly, eat a balanced diet with high-fiber foods, and drink plenty of water. 6 weeks pregnant, your symptoms. At 6 weeks pregnant, here are some of the symptoms you may be experiencing. Spotting. It's not unusual to see some spotting at 6 weeks, but it should be light, not even enough to cover a small pantyliner. This implantation bleeding is normal, but if you see a lot of blood, if the spotting lasts longer than 2 days, or you have any concerns, be sure to see your doctor right away. Cramping. At 6 weeks pregnant, slight cramping can be normal. It's a sign your uterus and the surrounding tissues are expanding to make room for your baby. If you feel pain more severe than usual period cramping, especially if accompanied by a fever or diarrhea, contact your doctor immediately. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help, so keep a little something on hand for those random bouts of nausea. Exhaustion. You may feel completely exhausted due to pregnancy fatigue, and that's okay. As your levels of the pregnancy hormone progesterone are increasing, making you more and more tired, you may find taking naps can help. Some women also say that little snacks and some light exercise are effective in fighting off fatigue. Ways to help yourself feel a bit better. No symptoms. That's right, it's possible to be 6 weeks pregnant with no symptoms whatsoever. Every pregnancy and every woman is different. For example, some women never experience morning sickness, so if you're one of the lucky few, enjoy these nausea-free days without worry.
Fast track to fertility, expert tips from a leading doctor. 1. Introduction. Welcome viewers. Today we're sharing the top 20 tips to boost fertility and increase your chances of getting pregnant fast. 2. Healthy lifestyle. Maintain a healthy lifestyle with a balanced diet and regular exercise to support overall well-being. 3. Nutrient-rich foods. Focus on nutrient-rich foods, including fruits, vegetables, whole grains, and lean proteins to enhance fertility. 4. Hydration. Stay well hydrated by drinking plenty of water, promoting optimal reproductive health. 5. Limit caffeine and alcohol. Reduce caffeine and alcohol intake, as excessive consumption can impact fertility. 6. Maintain a healthy weight. Achieve and maintain a healthy weight, as both underweight and overweight conditions can affect fertility. 7. Regular exercise. Engage in regular moderate exercise, which can positively influence reproductive health. 8. Balanced hormones. Ensure hormonal balance through a healthy lifestyle and, if needed, consult with a doctor for guidance. 9. Quit smoking. Quit smoking as it has detrimental effects on fertility and reproductive organs. 10. Stress management. Practice stress management techniques such as meditation, yoga, or deep breathing to reduce stress levels. 11. Regular checkups. Schedule regular checkups with a fertility specialist to monitor reproductive health. 12. Know your cycle. Understand your menstrual cycle to identify your most fertile days and optimize conception timing. 13. Tracking ovulation. Use ovulation prediction kits or apps to track ovulation accurately for better timing. 14. Position matters. Experiment with different sexual positions to increase the chances of sperm reaching the egg. 15. Optimal timing. Be consistent with intercourse during the fertile window to maximize the chance of conception. 16. Sperm health. Encourage sperm health by avoiding hot tubs, tight underwear, and excessive heat exposure. 17. Preconception supplements. Consider taking preconception supplements like folic acid to support a healthy pregnancy. 18. Limit exposure to harmful substances. Minimize exposure to environmental toxins and chemicals that may affect fertility. 19. Fertility-friendly lubricants. Use fertility-friendly lubricants that do not hinder sperm movement. 20. Patience and emotional support. Be patient and seek emotional support during the fertility journey, understanding that it may take time. Conclusion. Thank you for watching. Implementing these tips can significantly boost your chances of getting pregnant fast. Remember, consulting with a fertility specialist is crucial for
But on the plus side, you may be able to hear your baby's heartbeat for the first time, something to make up for the not-so-pleasant symptoms you may have been experiencing. You may be wondering when you will start showing. 8 weeks pregnant, your symptoms. At 8 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You may be dealing with nausea and even vomiting right about now. The good news is morning sickness symptoms usually subside during the second trimester, and you're almost there. For now, try nibbling on crackers before you get up, and aim for 5 or 6 small meals a day, rather than 3 large ones. Food and smell aversions. Certain tastes and odors that have never bothered you before may seem overbearing or repugnant, thanks to increased hormones that amplify your sense of smell and make your stomach feel as if you're on a wild roller coaster ride. Diarrhea. Your digestive system may be far more sensitive now. Make sure you're practicing healthy eating habits and staying hydrated. Contact your healthcare provider if the diarrhea lasts longer than 24 hours or is accompanied by any other symptoms, and do not take anti-diarrheal medicine or any medication before checking with your provider. Frequent urination. Yes, you may still be making lots of extra trips to the bathroom. This symptom will come and go throughout the rest of your pregnancy as your baby grows and your uterus expands, both of which put pressure on your bladder. Abdominal cramping. This symptom can be associated with the continued growth of your uterus. Back pain. By the time you are 8 weeks pregnant, back pain may strike, particularly around the lower back. That's because the muscles in your back are working a bit harder than usual as your weight is redistributed to accommodate your growing uterus. Furthermore, your center of gravity is changing, and those pregnancy hormones are working on relaxing ligaments in the joints of your pelvis.